Hey everybody, Dr. Mark the Cowboy here. I've got a YouTube channel I started. I'm a family physician, board certified, practicing for 20 years, and I wanted to put some good information out there for the public and even answer some questions from people. So one of the topics that was requested was preventive medicine and screening for men. And so I'm gonna present this talk so that you understand how the doctor's thinking, how he goes about choosing things for you as far as screening tests, etc. And going to try and be fairly inclusive about what things should be discussed and what kind of tests should be done. And then at the end, when I've covered all those basic things, I've also got a little special segment I want to talk about cancer in general. But anyway, to begin with, so it's your annual physical and you're going to the doctor. Some of this is going to depend on your age too, and I'll talk specifically on the ages of some of these tests so that you understand when you should have them and etc. But at any rate, everybody's going to get their vital signs done, their blood pressure and pulse and their height versus their weight. There's going to be a good history about your past medical problems, your family history. Family history is very important because it can alter at what time certain screening tests are done. For example, the colon cancer screening test, the colonoscopy, is usually done when a person turns 50. But let's say you have a family member or first-degree relative that had colon cancer when they were 50. Well, then you get yours 10 years earlier when you turn 40. Family history is important for that matter. We're going to do, social history, looking at alcohol and tobacco intake, looking at your exercise habits, what your overall activity level is like. Look at your job, see if you've got what kind of high risk exposure type things you might have there. Then to get more into the nitty gritty of exams and studies and things like that. In general, people should get a cholesterol panel done and glucose. It's better if you're fasting, if you hadn't eaten anything for 12 hours, because then you get a true cholesterol level that's fasting. If you eat something, it doesn't make huge differences, but for example, the triglycerides, which is part of your cholesterol panel, that's definitely going to be higher if you've eaten something. And the screening test for diabetes is actually a fasting blood sugar. So if you can get your blood drawn 12 hours fasting, that's the best test for screening for diabetes. Kind of going in head to toe order here. Vision screening is typically not automatically done at a general physical. And so I always just tell people, if you're experiencing changes in your vision, you should go see the ophthalmologist, somebody who can get a really good look at your eyes there. Respiratory. We used to do chest x-rays on people routinely. Medicine changes our recommendations based on evidence, based on studies, and large groups of studies were done that showed that the chest x-rays really were not very good at picking up lung cancers, certainly not early enough to really matter. And so unless someone is having a breathing problem, a chest x-ray is not part of your regular routine preventative medicine screening. Moving down to the GI tract, colon cancer is something that's looked at when you're 50, but sooner if you have a first-degree relative that had colon cancer at a younger age. There are two good, and I will say they're both good, screening tools for colon cancer. The colonoscopy is certainly the gold standard. It would be considered the best because it's direct visualization of things, and while they're in there, they can biopsy things if they see a mole or a suspicious spot. But the second option is called Cologuard, and Cologuard it's a stool study, but it's not just like the old stool test for blood. This is actually looking for the DNA of colon cancer, and the studies showed that it was about 97% successful at detecting colon cancer when it was present. It does have a bit of a false positive rate, particularly if there's any blood in the stool. So if you chose the option to do the Cologuard instead of the colonoscopy, you just want to make sure that there's not hemorrhoid or any fissure or anything that could cause a little bit of blood in your stool when you do the test, or it is going to make it a false positive. It's a good test for people who are maybe at a little higher risk for complications with a colonoscopy, or people that have had problems with anesthesia or the colonoscopy. And then there's just a large number of people who just don't want to have the scope, and it's a good. I'm not going to say it's as good, but it's a good alternative. So, all right, enough on that topic. Moving on, prostate cancer screening. Typically, you're going to get a blood test called the PSA, the prostate specific antigen is what that stands for. And a normal, completely normal number of a PSA is somewhere around 1. Can be a little higher, a little lower kind of thing. But as men get older, the prostate grows, and so there's more prostate antigen. So as you would expect, the PSA does slowly climb over time, and that is normal. What's not normal, though, would be for a PSA to double or triple from one year to the next, and that's the red flag where your doctor will say, you probably need to go see the urologist, might need to get some biopsies, etc. And your doctor may or may not be doing the digital rectal exam, feeling the prostate for nodules. And that's a debatable topic as well. But if you talk to the urologists, the people that actually treat prostate cancer, they are all still very much in favor of not only doing a yearly PSA, but also doing a yearly prostate exam. And with that, I'm going to move to the topic of cancer in general. All right, cancer has what we call a two-hit theory, the cause of cancer. First of all, you have to have a genetic predisposition to get a cancer. And then this two-hit theory is that then there's an exposure to something that creates the genetic mistake or the replication error as the cell is replicating. Any cell in your body can become cancerous. All cells in our body have a certain lifespan. Like, for example, a skin cell lasts of somewhere around 30 days, then it dies, and then we make a new one. And so this factory for making new cells has, think of it as a shutoff valve or a shutoff switch. And when cancer happens, that shutoff switch gets broken. So that it's not just replicating one cell because it needed to, it replicates and continues to replicate over and over and over. So that's kind of the general principle of cancer. As you heard from the first part of this talk, there's a handful of tests that we do that are specifically looking for some cancers, some specific ones. But there's an awful lot more cancer out there that we don't have good screening tools for. Quite honestly, I mean, over my 20 years, my career, I know there's been a number of times where we sort of stumbled upon a diagnosis of cancer. We were looking for something else ordered a CT scan of someone's abdomen or pelvis, and lo and behold, here is this spot on their liver, or here is this mass here or there. And the challenging thing is that even people with a strong family history of cancer, insurance will not pay for a screening CAT scan or MRI of a person just because they have a family history. I always mention this to my patients because I think it's very worthwhile knowing. If you happen to be one of these people that has a fairly strong family history of cancers, there is a group of radiologists down in Arizona that are doing an MRI that your insurance isn't going to pay for it, but they will do an MRI from the top of your head to about mid-thigh, and a few years ago the cost was around $1,000. It may be a little bit more than that now, but that is actually an exceptional value in my mind for a scan that covers that many parts of the body. But something I would consider looking into if I were you. They're called Preventium. With that, I'm going to sign off for today. If you have specific topics you want me to discuss, go ahead and put them down in the comments. Like the video if you liked it, and subscribe to my channel. I'll be producing many more of these. Thanks.